the piece that I'm about to present. So, hi everybody, Dr. Kogan, Medical Director of CIM, Associate Professor of Medicine at GW. So we're going to do a couple of things today. I'm going to show you an article which I think is critically important for everybody to understand and review, and actually quite a detail. So I think it'll take us close to 10 minutes to go over the article, and then we'll do Q&A. And then if time left, I have a couple of long COVID points, including some updates about next week and also some of the sort of things that we've been observing. All right, so I'm going to share my screen, and you should all see a Lancet study titled Past SARS-CoV-2 Infection Protection Against Reinfection, Systematic Review and Meta-Analysis. You guys seeing all that? Okay, good. So first of all, let me just, before I drop into the careful assessment of this, so systematic review is a way at synthesizing multiple different studies. The meta-analysis is a kind of a step up. Meta-analysis is a way of looking at the prior controlled trials and systematically assessing the quality of data and making sure that you're trying to compare apples and apples. The problem versus apples and oranges. The problem with regular systematic reviews, when you're doing this, you're always comparing apples and oranges. And so the conclusion of systematic review can be skewed dramatically by heterogeneity of the trials. Meta-analysis is a statistical attempt at trying to minimize those heterogeneity variabilities that obviously put the bias into the results. So what is this? So the researchers identified 65 studies from 19 different countries, and then they kind of pulled it all together. As you can see the results over here, but what I'm actually going to do, I'm going to go step by step to show you, and particularly I'm going to also concentrate on comparing the past infection to the vaccine, which based on this data appears to be stronger than the vaccine protection on both, on not just against severe illness, but also against reinfection, which is a big surprise, I think. For me, expect that this study will be featured everywhere in the news in the upcoming weeks, and it's probably going to be triggering a bunch of controversies because you'll see in a second why. Okay, so first of all, so this is funded by Bill and Melinda Gates Foundation. This is not a random organization. This is a very solid group of researchers who've done the work. Now, of course, before I go into analysis, it's a critically important question. If you had a past infection, how long will you be protected from that point? And how long you will be protected against getting the symptomatic infection and against severity of illness? So basically, and can you compare that protection of the prior infection against the vaccination? So I'm not going to bother you with methods. Now, those of you who are interested, I will definitely put the link into the chat if you want to see the whole article. But generally, this is a standard meta-analysis assessment. The one critical aspect of problems with any systematic review, including meta-analysis, the inclusion criteria. You could easily drop out studies which are important. Now, I have not done my due diligence to try to assess this. This is the most difficult part of any assessment of systematic reviews. Which studies were included, which studies were excluded? Can you compare that, and can you make some decisions based on what has been excluded? Because quite often the data that's not in the study speaks louder than the data that's in the study. So let's put that as a side note. I can't really formally analyze this just because this is a very large amount of data. And so, and they do talk a little bit about it. They talk about inherent risk of biases in an assessment like this. Okay, so I'm going to skip some of this stuff. Honestly, it's not essential, but you can find a whole list of all the studies here. Obviously, everything is 22 because it's all fresh, right? So it says new data. Okay, so this is the first critical slide, or not slide, the picture. So you're looking at the previous infection. Each dot represents a particular study. So it's kind of hard to see that what they're doing is this line that they're putting, that's the line that estimates the average of it all. And you see how that's a kind of totally everywhere, that's expected. Okay. So let's move to the next. There's not much else important here because I actually want to, no, that is important. So what you're seeing at the bottom of this on this line, that's number of weeks. So each one of these graphs goes up to over 75 weeks. So the first is 25, first line is 25, this is 50, this is 75. So as you can see, if you look at the ancestral or initial strains, the first infection, even at the 75 months, you still have more than 50% average protection. So 75 months, that's a long time. So this is completely negate prior idea that somehow after 3 or 6 months, your protection from prior infection is gone. Completely not true according to this. Now, Omicron did not do very well. As you can see that is about a third protection, but again, this is 75 months. The way they describe this, they put a critical point of 40 weeks. I am not 100% clear why they did this, except that maybe 40 weeks sits right here where you see this precipitous line and then it levels off at kind of about 30-35% protection left, so not much. Now, this is against reinfection, okay, so symptomatic reinfection. This is not against serious illness. This is serious illness. Here, this is almost more than 80%, even at this point, which is about 60 months. 60 months is a, you know, is it a month or is it a weeks? Weeks, apologies. This is weeks, not months. So 75 weeks. So this is at the 60 weeks, there is still nearly 80% protection here against severe illness. Okay. Okay. So that's, and that's against prior infections. The Omicron, it's even higher. No, sorry, here, Omicron, it's even higher. What I find is really interesting is there appears to be a beginning of a drop at around week of 40. I think that's what the critical aspect of the study. They're basically saying until week of 40, you appear to be completely protected against severe illness, okay? And then something happens here. So of course, I hope that the same group a year from now will do the same exact analysis to try to simply extend this point to, you know, way over a year, because here they stopped at just over a year, and that's simply because they don't have enough data sets, right? I mean, we haven't had disease long enough. But this is very encouraging. Now, and I'm gonna go straight to even more important slide, and that's this. Now, it's a little hard to see here. Past infection is this line. It's kind of a green and black. I already tried to make, let me try to make screen a little bit bigger. And you may be able to see. Okay, let's just concentrate first on this graph, and then I'll try to come back. So you see, this is a natural infection, and then this is, let's just take Pfizer, the green line, and Moderna, this red line. Why they stopped at less than 20 weeks here beats me. I don't know. Maybe they didn't have enough. I didn't read carefully why some of the slides, they didn't analyze against the vaccines long enough. So they just, because they concentrated obviously on the natural infection. But this is the against ancestral alpha or delta, the natural infections do dramatically better than vaccines. It's not even comparable. I mean, the vaccines here by the week 50, I believe this is, let me just make sure I'm not, week 40. So this was week 40. By the week 40 here, protection from Pfizer was at about 30%, maybe 40. Protection from past infection was still way above 50%. Okay, so I'm going to make it smaller and show you this side of the. So now this is Omicron, because obviously this is more important for us since we don't really see this anymore. So here, nobody did well, bottom line of the slide, right? So you can see that this is the natural protection when after 40 weeks, it was way under 50%, but it was still holding close to 40%. And this was kind of similar to Pfizer and way better than Moderna. So based on this, actually, the most practical point I took, everybody get Pfizer. right? Because Pfizer seems to be performing against Omicron better, dramatically better than Moderna. Why Moderna? And I'm sure this is going to be more discussion about this, and probably somebody smarter than me will figure out why the Moderna didn't do so well here. Okay. Okay, and the severe illness, this is most important part. So this is infectivity. So it means that if you were to get, like me, let me give you myself. So I had the disease back in March, late March last year. So it means that at least until roughly now, I'm at about 40% protected against any symptomatic repeat illness of Omicron. Now, how am I protected against the severe illness? And this is where I think where the gold is. If you look here at week 40, it's stated 90%. Look at the other vaccines, they're all dropped out. And the difference is large. Now, what they're not telling us is what if you combine natural immunity with the vaccine? Can you get over 90%? Frankly, I don't care. 90%, good enough. So I'm, as a young, healthy person looking at this, going to probably say, so because for me, it's important that my patients don't get illness if I get sick. But how much of this Pfizer booster is going to bump up my own natural immunity against getting any illness? I don't know. And until I know this, I'm going to presume not by much. Meaning, until more data is available, young, healthy people should not, who had an infection, should not even get any booster at any point, maybe even a year after, because there's no data. And actually, there's data that it doesn't make sense, according to this. Until we know that somebody will do analysis combining the natural immunity with this, let's say, Pfizer, showing that that combination will outperform natural immunity alone, right? So that I'm just basing this on the effectiveness. I'm not talking about any side effects of anything here. It's just and now against the severe illness, which in some ways is even more important, I love the fact that now this is over 50 weeks, so year out, we're still seeing way more than 75% protection. But notice that there is a beginning of a decline. Now, that decline is still very small. I'd love to see more data here as to what will happen. It may be, by the way, that collecting more data here will eventually become irrelevant if the Omicron will disappear, if we're going to end up with a new strain. They're going to have to redo this type of study over and over again as new strains show up. So in summary, highly encouraging. If you had prior mild infection, congratulations, right? Looking at this, that's what you should say to yourself. That's what I'm saying to myself. And now it's even more controversial as to at what point should everybody get boosters. Me looking at this, highly individualized. If you're relatively healthy, no problems, I'd say absolutely no boosters at all, none, until I see more data. If you have medical problems and we want to try to get this as close to 100%, individual decision. I think this is going to be probably starting to get pushed toward a main CDC line. Young, healthy people, don't worry. You know, you're probably okay if you had the first series of shots, and then on top of that, you got a natural immunity from mild COVID, you're okay. High risk people, yes, boosters. What frequency? Now I'm less confident to say every 6 months. I'm definitely saying every 12 months, maybe even less, at least for now. So with that, oh, that's pretty good. I took about just close to 10 minutes. So I'm gonna stop this part and check the chat and see if we got any questions. And I'm gonna put the study link in there in a second, as soon as I get myself reoriented here.
If you're uncomfortable with typing in the chat window, you can unmute yourself and ask Dr. Kogan your question directly.
Okay, and by the way, those of you who, I don't know if I said that. So this was published in Lancet. Lancet is considered to be the top premier article in the world, journal in the world, probably as good as JAMA or New England Journal of Medicine. It's an English journal. So, okay, do we have questions? how does this explain how some people would be more prone to reinfection after initial infection? Seem contradictory to what? No, right? So remember what it looked like? Only about 40% you are protected at about reinfection. You're protected against serious illness at over 90%. But reinfection protection is very small, relatively speaking. So, and of course, there's variability. There are some people who get reinfected and some people who don't get infected or reinfected at all. That was my second topic for today. I don't know if I'll have time to talk about this. There was a study last week about a receptor in the lungs that may explain why some people never got COVID. But I kind of find that not as interesting because that receptor is not clinically, you can't clinically assess it. So I don't know, like I can't order it on the patient and end up saying, oh, good, you're never going to get COVID. We don't have that. But that explains why some people get it less or more, because the degree of expression of that receptor, and if anybody savvy enough, you find that name of the receptor, it escapes me right now. I have to click on an article to pull it up. But
Misha, we're gonna, sorry for the interruption. We're gonna forego the wellness talk, so just keep talking, but
yeah,
you have a hard stop at 2:30.
Yeah, well, that was my plan. This is more important to my understanding than kind of quote unquote wellness, because I think everybody needs to understand that. So this would be the current most up-to-date information. And since this issue of when do I get booster comes up, it's so important that I
Absolutely.
talking about it. Okay, so for someone who never got COVID, is it still recommended to get a booster every year? Yes, I think that actually is very reasonable, right? Because now you could, that's actually a really interesting point. I just thought of something. You could arguably say, wait a second, how do I know that I did not have an infection? I may have had it asymptomatic, right? So you could theoretically see your doctor and say, hey, can I get an antibody checked, both to the vaccines, but also to the native immunity, just so I know. It may be a reasonable thing to do, but it's not necessarily going to fit this study, because the study didn't look into that. The study just looked at people who had COVID, who've been documented to have COVID, right? They didn't analyze the serologists to say, okay, this person had COVID because we found antibodies. That's not how this was done. So you may or may not be in the same boat as people who were symptomatic if you had an asymptomatic infection. But I think it's very reasonable timing. I would say if you'd ask me what I would generally recommend, I say get a booster annually if you never had COVID, and good for you. But it may be individually discussed. So if somebody has a lot of risk factors, like a poor immune status, maybe a transplant patient or severe diabetes or some other complications like, for example, cancer, I may actually opt for more frequent vaccination if person never had COVID. Remember also, this is a general population. So the analysis was not broken into very specific categories. That would be a whole lot more research to be done, to take this data, look deeper in it and say, okay, who out of all these patients had cancer? Who had that level of analysis? Probably going to take additional months, if not at all possible. They may not even have the data like this. So, okay, it's a good question. This is very timely. Thank you. My whole family got our first COVID infection this past September. We were planning to get, okay, so if your family is relatively healthy, don't get your vaccine. There's no point, as we just discussed, right? Because unless, again, Monica, this is important, unless some of you or all of you have particular medical conditions that put you at the high risk category, then you should talk to your doctor. But based on this, if you're, let's say, not over a certain age and you don't have a lot of risk factors, I don't see any reason to get 6 months booster here after your infection based on this. That's why this study actually literally going to change my practice, at least until I see something better than this, or newer, not necessarily better. And you will see that this will be critiqued. Why? Same reason I mentioned when I started talking about methods. I'm sure that there's going to be a lot of critique to say something like this. How do we know that you have included all the data? And also look at that graphs on vaccines. Why did you drop the vaccines early? So there's going to be problems. I mean, every study has a problem. There's no perfect analysis of any kind. So, but nonetheless, to me, this is good enough for now, because this is just robust. And I forgot to mention, I think the total number of patients in all of these studies, they mentioned that somewhere, but we're talking millions of patients. This is not a small cohort. I don't know if I can find it quickly. So if anybody has time to look through the study, by all means, but that, you know, you're talking about a large number of total studies. So the number of patients, total number of patients was very large. So, and then you're also going to have to decide, because most of the studies were done in Europe, but they did have studies in Africa and Asia. And you know, for example, there's a study in Nicaragua and study in Qatar. So it's probably does represent a broad enough sample to cover, you know, all of our bloodlines and all of our ancestral lines. So, okay, do we have any other questions? Is over age 70 but healthy? Yes. So anybody over 65 by default falls into the high risk category. So Mark, I recommend you talk to your doc, but you do take the study into consideration and make decisions. But it is correct that the issue here is the age alone is the risk factor. One of us is a 49-year-old cancer survivor with autoimmune condition and diagnosis of tachycardia after COVID, and the other adult is 48 and mild asthma. Okay, yeah, you should check in with your docs, because this is not like, if you're, I think the person who's 48 mild asthma probably should be considered relatively healthy, especially Omicron does not tend to cause severe asthma or pulmonary disease. So you probably, that person's probably okay. But the person who have a history of cancer and autoimmune condition and had a complication of acute COVID, I probably would consider vaccinating this person. Now, the question is at what point? Monica, that's a hard question. I don't think I can comment on that, because I would need to know more data. I may need to get blood work. I will need to understand patient a lot better before I could make a comment whether I think it's safe or not safe to not get a shot here. I mean, if we'd go back 2 weeks ago, I'd say get a shot. I wouldn't even like talk about it. Now things with this study going to be a little bit different, I think. Any reason why Pfizer vaccine would work better? Yeah, so I don't understand this. Remember, I don't know if you guys can go back to the slide. I'll share the screen in a sec. Yeah, I didn't quite understood why that happened. Where is it? I don't know if I can quickly find it now. Bottom line, the Moderna did, oh yeah, the Omicron infection. Hold on. Okay, so it's this slide. It's this right window here under B. You see that the Moderna, this is this line, blue line. Moderna basically protection against Omicron, symptomatic Omicron, went basically to 0 at week 40. And Pfizer maintained here, without hint that it will crash this way, maintain at about 40%, kind of similar to where the past infection sits. That's the only practical major difference here, in my opinion. Like, for example, for symptomatic disease, the lines are almost identical. So it does look like Pfizer protects against any infection a little better, but also here, well, here it's a reverse. So here is severe Omicron. It looks like that the Moderna did somewhat better here. But they stopped analysis at 20 weeks. So what would have happened from here to 40? Who knows? So there's a lot of holes with vaccines here. I don't think we can use this study for talking about vaccines efficacy at 40 weeks. We can only talk about natural immunity here. But nonetheless, there's some interesting differences, which, I mean, I think I was pushing towards Pfizer more anyway to begin with because of the quote unquote documentation of somewhat less side effects. I think this doesn't necessarily help me one way or another, but still. All right, last question. I have 2 minutes left. Let's see if we have anything left. All right, well, I don't see any more questions, and we can then stop right here. And Cynthia's welcome. Oh, before I pass it to Cynthia, since I think we'll just end at 3. So next week at 11 a.m., we're going to have a long COVID open house. I think Cynthia hopefully will join us there too, or Nina. So please come. I will put a Zoom link here, but also if you need a link, email us. We're also going to send a blast email to everybody. Maybe Janet can also send it next week to your listserv at the office. Oh, wait, that's a long link, but I put it anywhere. Okay, thank you, everybody.
And thank you. And hello, everyone. I'm delighted to be here with you. And the practice I'd like to share is the body scan. And the body scan practice consists of systematically moving our attention through the body. So bringing awareness to any sensations that are present and can be felt moment to moment. And along with attention to sensations, you may notice emotions or thoughts arising as you engage with various parts of the body. And the invitation is to be with things as they are. So that includes noticing thoughts and emotions and letting them arise and pass on their own as best you can, without getting pulled into any possible stories. Now, at any time during the body scan, if sensations or the emotions that they evoke become too intense, you can perhaps use the breath as a focal point or an anchor, and stabilizing with the sensations of breathing, or perhaps bringing your awareness to the sounds in the room. And then returning to the region of the body when you feel ready, if that feels appropriate. So I'm going to invite you now to begin settling into a position that is comfortable. You could be sitting, standing, or lying down. Just one that allows you to be alert and receptive, and is also respectful of the needs of your body as it is right now. So just taking a moment or two to get yourself situated, starting to take in your space, and with your sense of sight and your sense of hearing, and being aware of any mood that's present, emotions that are here, or thoughts that may be coming and going. Perhaps you're noticing physical sensations in the body. And just acknowledging how it is right now. And again, allowing things to be just as they are. And holding whatever is here with kindness, as well as curiosity. I'll invite you to close your eyes or gently lower your gaze if that feels more comfortable. And now tuning into the body, starting to notice your posture, and perhaps making little adjustments if that helps you to feel a little bit more grounded or a little bit more stable and supported. And again, bringing your intention inward, tuning into the whole body. And starting to feel places of contact between the body and whatever is beneath you. So you might feel pressure at the soles of the feet, maybe sensations along the backs of the legs, perhaps noticing some sensations in your lower back, and noticing any tension or contraction in the body. And wherever there is clenching that can be released, seeing if you can let that happen. And where there may be tension that can't be released, just giving it some space to ebb and flow on its own. And if at any point you find yourself distracted, perhaps focusing on different thoughts or emotions, just gently bringing your attention back to your breath, or back to sounds in the room, or back to the region of the body that we're concentrating on within this practice. Knowing that noticing that your thoughts and your mind has wandered is actually part of the mindfulness practice. So beginning with the brow and the forehead, just letting them be smooth. And softening the muscles of the face, releasing the jaw. Letting the shoulders relax. Letting the hands be loose. Releasing the muscles and the legs and the feet. Again, noticing if there is any clenching or tension in the body. Seeing if it's possible to soften it. And we'll begin moving the attention around the body and tuning in a little more deeply to sensations. And as we do, you may discover areas of physical pain or mental agitation. And in that moment, knowing that you have a choice as to whether you like to move in with your attention and explore what's here a little more closely, or move away and rest the attention in a place that feels more neutral. And knowing that either choice is fine. And so guiding the attention down the body, all the way down to the feet, noticing where the feet are making contact with whatever is beneath them. Perhaps feeling sensations along the soles of the feet. You might be feeling pressure, might be buzzing, pulsing. Perhaps you sense a certain temperature or textures. And then moving your awareness to the tops of the feet, sensing what's here now. And coming up to the ankles, again tuning into any sensations, noticing thoughts, noticing emotions, and again letting them rise and pass on their own to the best of your ability. And continuing to move awareness up the legs, sensing whatever you feel on the surface, aware of the calves, the shins, and coming up to the knees, and resting your attention here. Noticing what you're feeling as you continue up the legs. And passing the thighs and the quads, moving to the hips, and sensing the hips connecting to the legs and to the torso. Becoming aware of the pelvic floor, the pelvic bowl. Feeling whatever you can here on the surface, as well as within. And guiding the attention up the torso, aware of the mid-torso, the area of the waist, and the ribs. Sensing the front and the back, sides of the torso, on the exterior, as well as any sensations that you feel within. And now moving your awareness up to the upper torso, sensing the shoulder blades and the underarms, the chest and the collarbones, shoulders, and sensing the breath, and perhaps even the heartbeat. As well as any other sensations that may be arising. And guiding your attention down the arms, so the upper arms, letting your awareness rest at the elbows, moving to the lower arms, forearms, and guiding your attention to the wrists, Now turning your attention to the hands, aware of the palms and the back of the hands. Sensing the fingers and the thumbs. Noticing what you feel here. And again, noticing if the mind has wandered. It's okay, you can acknowledge where the mind is gone and guiding it back to the hands or to the breath. Now guiding your attention back up to the shoulders and starting to sense the neck, aware of the back of the neck, sides of the neck, the front, the throat, and sensing the neck connecting to the head, and bringing the attention to the back of the head. Again, feeling sensations on the surface as well as within. Sensing the ears. Sensing the jaw. Just gently scanning the face. And becoming aware of the chin and the mouth. Bring your awareness to your nose, your cheeks, your eyes and eyelids, forehead. And now bringing your attention to the top of the head. And letting your attention rest here at the crown of the head. Again, tuning into the body with a sense of kindness and curiosity. And now widening the attention to take in the wholeness of the body exactly as it is. So beginning at the crown of the head, back of the head, the face, the ears, bringing your awareness to your neck, and your neck connecting with your torso and your shoulders. Again, perhaps tuning into your heartbeat. Awareness of the arms and the hands. Noticing sensations in the upper torso, mid torso, lower torso, front to back and side to side. And continuing to widen the attention, sensing the hips. Stay connected to the legs. Noticing the thighs, knees, calves and the shins. All the way to the ankles. The ankles connecting to the feet. Top of the feet as well as the bottom that includes the sole and the arch, the balls of the feet, and the toes. And again, sensing the wholeness of the body. From the crown of the head to the tips of the toes. And resting here in wholeness of the body. And again, bringing your attention to any sensations within the body. And noticing how you're feeling right now. So now tuning into the body, tuning into the heart, tuning into the mind. And again, holding whatever is here in a field of kind awareness. And as we start to bring this practice to a close, I invite you to bring some gentle movement to your body, perhaps wiggling your fingers and toes, perhaps gently stretching your arms and your legs, and moving your body in a way that feels nourishing to you. And whenever you're ready, opening your eyes. And I certainly would be open to answering any questions that you may have. However, I did want to share with you that through GWCIM, one of the many offerings is MBSR, also known as Mindfulness Based Stress Reduction, which is an 8-week mindfulness training program that was created by Dr. John Kabat-Zinn. And it's now used for a wide variety of reasons by hundreds of thousands of people worldwide, supported by a huge body of research showing that it's effective at addressing chronic pain, anxiety, depression, as well as general stress reduction. The next course will start March 23rd. It's offered from 6 to 8:30 p.m. And there is a free orientation at 6 p.m. on March 16th. And this entire program is offered online from, I guess, the comfort of your home. And I'd be happy to answer any questions that you may have. Is there a link that you can share? Yes, certainly.
And these links will also be in the email I'll send out after today's meeting.
Thank you, Janet.
I just put more precise link. There's a specific MBSR link. And we will, right now, I don't think it's already updated. So we already have new dates set up in there.
Mm-hmm.
And you can register directly online if you want. Any questions to Cynthia?
Any questions for Dr. Kogan?
Everybody have a wonderful long weekend. Our President's Day. We'll see you all next Friday. Janet, what do we have next Friday?
Well, that's the thing, Misha. We don't have anybody. So
all right, we'll work on that.
We'll work on it.
Well, one option is to move our long COVID somehow. All right, Janet, we'll talk offline.
Okay.
All right. Bye, everybody.
Bye,
Ciao, ciao,
everyone.
everybody.